So in this episode, I want to talk to you guys about returning an athlete or returning a patient back after a back injury and looking at, is stability of the core, is stiffness of the spine an issue for that patient? So I want to go into a little bit about assessing and then also some follow-up exercises that you guys can throw in there. Now, again, this is not the full-on assessment. It's just a piece of it, okay? Looking at what their discrepancies might be, what their compensations might be, and how we kind of move forward from there. So something I want to look at in the assessment, I want to look at, do they have standing core control, okay? Are they able to stand upright and move their hips, move their knees without leaning forward, leaning to the side, leaning over that hip? Is there a hip drop? So things to look at. Looking at a plank position, having them do almost like a bird dog, lift their legs, lift their opposite extremities. Can they weight shift from one arm to the other without rotating their trunk? Is there a torsional component to their discrepancies in their lift? And that's something you can also see in their regular squat, bench, deadlift movements. Are they able to maintain that upright posture? Are they able to control, brace that spine for them to keep doing well in whatever sport or whatever lift that they're trying to achieve? And then looking at a plank and a side plank, how their actual abdomen works, how their erectors work, how their multifidus works, how does their obliques play a part into stiffening that spine, protecting that spine, okay? I like those as well because they're very good objective measurements, so you can get a time from that and you can kind of track their progress from there on out, and they can track their progress as well, which is most important. Then I'm going to go into a few exercises that I've handpicked. I love Stu Miguel. I take a lot of his stuff. I always put the big three in a lot of my patients' protocols, but here's some other ideas to go along with that as well. So I talk about T-spine extension and the importance of T-spine extension, especially when you're talking about a patient who's very kyphotic, that they have that rounded mid-back appearance, because a lot of times those athletes can't even get their cervical spine onto the bench, which is super important. So I talk a little bit about doing some PNF extension work. I'm going to go into the bird dog. We're going to go into a one-arm kettlebell swing. We're going to go into stirring the pot on a physio ball. We're going to do a one-arm dumbbell bench. I'm going to do it on the floor, but you can also do it on the bench. And then we're also going to talk about the importance of farmer's walks or suitcase carries. Again, there are so many things on the internet that you can be doing. There's so many different core things out there, but this is just a few of my hand-selected ones I'm going to put on this video. Okay, so here we're going to go into the assessment portion of looking at stability control for the pelvis or for the athlete. So what I was talking about in the beginning is standing core control. Are they able to maintain their pelvis stability while moving their lower extremities? So what I'm going to have them do is I would have them get into a single leg stance and have them rotate and actually do a knee circle. And then you're looking at, is that trunk really bending to support that leg? Or are they able to maintain upright posture and you're not seeing almost like that Trendelenburg hip where the hip tends to drop, they tend to bend over that hip, that tends to be a little bit weaker. And then I would do the other side. So you always want to look left and right, okay? Even if you have an athlete that's doing a powerlifting sport, you are still looking at left and right. So then I'd have them lift the hip, I'd have them do a circle. Are they able to maintain that upright posture without that compensation? Okay, and now we're gonna go into the torsion control. So I'm gonna get myself into a high plank position here. And I really want you guys to see where my discrepancies are, where my compensations might lie. So if I'm in a high plank position, I'm gonna have them lift each leg independently. Are they able to do that? Are they able to control that? Now, I'm going to lift my elbow, my arm, my hand to my elbow. Am I able to do that with control, without shifting, holding, without rotating? So you're looking at all those different aspects. And then I'm going to have them go into a regular plank and a regular side plank. So, are they able to maintain a good plank with good position? Are they able to control a side plank with good control, good position? And how long is that? So I would even do a couple of trials here and there to actually time it out, what their best time is, and then you can use that as an objective measure moving forward. Okay, so now I'm going to go into showing and exampling some of these exercises for you. So the first one I want to show you guys is the thoracic extension one that I was talking about, and the importance of having some thoracic extension, especially with those kyphotic patients or those kyphotic clients of yours. Importance, again, if you're talking about a power strength athlete who needs to bench, are they able to get that cervical spine on the bench? Is that spine actually offsetting that and not allowing them to get the full cervical, lower cervical flexion that they need for protection? So I'm going to take the chair. That's just about my height. You can use a box jump, or you can use anything that's pretty level. And what I want you to do is I want you to get them down on their knees and their toes stacked. They're going to get their elbows on top of the bench, or they're going to get their elbows on top of the seat. And then they're going to put their hands interlocked behind their head. Now, you want to use the breath with this. So when I inhale, I'm going to fill my belly, make myself look like I'm a little fat. So I'm going to inhale, fill the belly. When I exhale, I'm going to actually draw my elbows into the chair. I'm going to exhale, keep breathing. My spine's going to extend, my head stays the same. I'm arching my tail, my hips are shifting to my heels, and I'm going to hold for 10 seconds. And then relax. And you can do that for about 10 repetitions. It's a great warm-up for any type of power strength movement or any type of thoracic work, any type of shoulder work that an athlete's going to do. All in all, I think thoracic extension should be a great place to start. Okay, now we're going to get into the bird dog. So I'm going to scoot this over for a second. Again, this is where we're looking at that torsion control. Is the athlete able to stabilize that pelvis? Are they able to stiffen that spine? Now we're talking about the erectors, we're talking about the multifidus and the transverse abdominis here. Okay, so on all fours, you're going to have them stack their feet, maintain a neutral pelvis, and you want to lift opposite arm, opposite leg. Now, are they able to maintain that nice straight line? Or is there a discrepancy there or a compensation there? So again, the exercises that you're actually implemented can be an assessment tool as well. Okay, now we're going to go into the suitcase carry. So you're going to grab a relatively heavier kettlebell or dumbbell, and they're going to have to maintain upright posture. And you're going to have them walk a certain distance. I don't want to see this. I don't want to see any compensation like this, because then that tells me there's something that's going on. There is some sort of neurological deficit. There is some sort of core control deficit that's going on with the athlete. Again, a great way to use an assessment tool. If there's no pain, you don't want to load that just yet. Okay, now let's go into a one-arm kettlebell swing. With this, I don't want to talk about a squat, I want to talk about a hinge. Hinge is super important. So one-arm kettlebell, and they're going to hinge from the hips. So we're not squatting, okay, we're hinging. So they're going to hinge and you're going to power through. Again, great way for core stability, core control. We're doing that crossover. Okay, we're using the lats, we're using the erectors, the obliques, all to stabilize the pelvis. Now let's go into we're gonna go into stir the pot actually. So I'm gonna grab my physio ball, and I'm gonna get into a high plank position here. My forearms are going to be on the ball, my feet are stacked wide, and I'm going to circle clockwise and then counterclockwise. And I'm trying to maintain that upright posture, okay? I'm trying to look at the spine. Is it sagging? Is it compensating? Am I having a torsion over that hip to achieve that motion? And now I'm going to take you guys down to the floor with me, and I'm going to show you a one-arm dumbbell press or kettlebell press. Now again, I would like this to be on a bench as well, but you can be really creative with this on the floor too. What happens when I use one arm versus doing two is I really have to engage that other side of my core to stabilize and maintain a nice neutral position. So the kettlebell is up. I like doing this with a bridge. I'm going to bridge up, and I'm going to press. And obviously I will do both sides. Now, if you guys have any questions, please please don't hesitate to leave them in the comment section. You can also like and subscribe to my channel, and I promise I'll put more videos out there for you. If you guys have any that you'd like to see or you'd like me to talk about, please don't hesitate to reach out to me, DM me, leave me a message. Everything that you need is right in the comment section. Have a great day, everyone.